All right, guys, this video would be relevant for managing discogenic symptoms of right-sided low back pain. We're gonna have the patient lie with the painful side down on a firm surface. The firm surface is important. If you have a sagging bed, it changes the dynamic entirely. So painful side down on a firm surface with the legs initially in a little bit of flexion and the patient's head resting on a pillow, just like that. What we're gonna be trying to do is rotate the left shoulder back towards the table. So we're generating left trunk rotation, painful side down. This is closing down on the disc. And once we're able to get a decent amount of pain-free rotation to the left, you can have someone assist and provide further overpressure on the left shoulder while maintaining the legs in that position. So I'm gonna scoot out a little bit, but we're trying to basically kind of wring out the space and close down on that disc on the underside. So we're maintaining the legs all the way off to the right as we rotate the trunk as far as we can back to the left. Again, we can have some assistance into overpressure here. From there, ideally we would start straightening out that bottom leg, and then you can continue to do this. That's a further progression from that. And then at the end, depending on the person, we're either going to be trying to roll them back into flat on supine or potentially prone positioning and moving to prone on elbows to further extension. When you get up from this, the other thing we need to consider is we're trying to keep the right side closed as we get off the table. You want to move with the right side down to the front of the table, drop the legs off, which accentuates right side bending, which further closes down on the right side, and then maintaining that, push up into a tall extended sitting position, and then try to quickly stand up as quickly as you can. We don't want to flex or roll down in sitting because that reopens up the posterior disc space. So hopefully that's a good progression and just kind of outlines how we would want to manage, again, discogenic symptoms for right-sided low back pain.